All right, it's 7 o'clock, so we're going to go ahead and get started. So I'm just going to say a couple of things before I hand it over to Dr. Kia Washington. We have an extremely distinguished visitor today, Dr. Ayla Stanford, and we really look forward to her talk. Dr. Washington will give you all the particulars about all of her accomplishments, and I read through her CV, and I'm just amazed. So Dr. Washington has really done a lot of work over the last years and is now leading our Office of Access and Engagement. We live in some very interesting times and have challenges at the university and in the Department of Surgery. But one thing is for sure, that if we have people with different opinions and different backgrounds and different experiences in life, we will make the best decisions possible, right? And we are in charge of taking care of the people in the state of Colorado, as well as educating the leaders who will go out to all of the United States. And it's very important that at the leadership level, at the faculty level, at the trainee level, and at the patient level, we reflect the population and the populations that we are taking care of. So we have, I think, some challenges ahead of us, but we have to keep our eye on the ball. And I'm going to hand it over to Dr. Kia Washington. Thank you.
Good morning, everyone. Thank you for attending our 5th annual visiting professorship from the Office of Access and Engagement. Although our name is different, our mission is very much the same and moving forward with all of our endeavors. It's really my great pleasure today to introduce Dr. Ayla Stanford. We were together training in Pittsburgh, and she's also a dear family friend. I've always looked up to her as a woman of authenticity, integrity, and brilliance. And I'm thrilled that you get to experience just an hour of her brilliant light today. And once you see her present, you'll kind of understand what I mean. So Dr. Stanford is a pediatric surgeon. She's the founder of the Black Doctors Consortium and a national leader in health equity, a healthcare policy advisor, and a former regional director of the U.S. Department of Health and Human Services, appointed by President Biden. Dr. Stanford is a professor at the University of Pennsylvania in the School of Arts and Sciences, with additional appointments in the medical school and School of Communications. She's a practicing physician for over 20 years and founder of Real Concierge Medicine. She is a board-certified pediatric and adult general surgeon. She is a medical and health correspondent for national media outlets as well. Dr. Stanford's book, Take Care of Them Like My Own, is part memoir and part manifesto for health equality and justice, and it was released in August of 2024. It offers urgent lessons about the power of communities working together to take care of one another and the importance of fighting for a healthcare system that truly fulfills its promise to all Americans. Her book has won many awards. It's Take Care of Them Like My Own has also been celebrated on local and national media, including NPR Fresh Air with Terry Gross and ABC Nightly News and MSNBC. Dr. Stanford gained international recognition during the COVID-19 pandemic using the infrastructure of her pediatric surgery practice to create a grassroots organization focused on education, testing, contact tracing, and vaccination in communities lacking access to care and resources. She and her team provided dire care for hundreds of thousands and countless others nationwide. She subsequently opened a multidisciplinary ambulatory care center bearing her name in a neighborhood in Philadelphia with one of the lowest life expectancies in the city. She has received many awards, including Top 10 CNN Hero and one of Fortune magazine's World's 50 Greatest Leaders. She's also received the American College of Surgeons 2023 Domestic Surgical Volunteerism Award and the George H.W. Bush Points of Lights Award. She even has a street named after her in Philadelphia. She lives in the suburbs of Philadelphia with her husband and children. And again, it's my great pleasure to have her come speak to us today. Thank you.
Good morning. Good morning. Thank you all for being here and inviting me to your beautiful campus. I have no disclosures, but in my time with you today, I want to talk about my journey from pediatric surgeon, doctorpreneur, I guess is a term now, presidential appointee, back and beyond. I'll just mention briefly, I trained at Pittsburgh, University of Pittsburgh. You heard Cincinnati Children's Medical Center, where I had the honor of being trained by Dr. Alberto Pena. So 5 years ago this month, we all know what was happening in our lives. And I'm a pediatric surgeon. I'm operating, I have my own practice. I operate at St. Chris, I operate at Children's Hospital of Philadelphia. But being from Philly, everyone was calling me saying, Ayla, I think I have COVID. I went to the hospital and I was turned away. And then I would call the hospital and say, you just turned away Mr. Jones. He meets criteria. He needs a test. I'm so sorry, Dr. Stanford. I'll get on it right away. And I was doing that all day. And the people who were calling me were Black, with insurance, and educated. And I kept getting calls. So I reached out to officials to say, I'm a surgeon. We're not operating right now. How can I help? And everyone said, yeah, these are tough times. And the disease were highest in certain zip codes and all the resources were in others. And when people went to those zip codes, if they weren't in a car, they couldn't get tested. They were only doing drive-ups. If they were kids and they went to an adult hospital, they couldn't get tested. If their doc wasn't on staff, they couldn't get a test. If they didn't have a script, they couldn't get a test if they weren't over a certain age. So I took all the gowns and the gloves and the masks from my office. I had an account with LabCorp. I begged them, even though I was not a primary care physician, to get testing supplies. And then I went to all the communities where the disease rates were the highest. I partnered with churches because that was a place where in Philadelphia, Black people were dying at a rate 3 times greater than whites in the group. So I went to a place that they trusted. So I went to the mosques, I went to the churches, and I asked my pastor to ask the other church members, all I need is your parking lot, electricity, and a restroom for my staff. And that's how we got started. And then subsequently from that, we went to vaccination. And as you can see, Bloomberg News reported we vaccinated more Black Americans in Philadelphia than any other city in the United States because we started early and we were intentional and we went to the communities that needed the help, the most vulnerable. Once the vaccine became available, I went to the health department and I said, we're ready. We've got a well-oiled machine. We've been testing 200, 400 people a day. We're ready. And the Department of Health said to me, Black people don't want to get vaccinated. They don't trust it. And we can't give you vaccine because it'll be wasted. Remember back then it had to be thawed down to -70, -80. It could only sit out for a certain period of time and so forth. And I begged them and they said, maybe in a couple months, but right now we have to give it to the people who really want it. And I kept pleading and saying, it matters who's giving it and it matters where they're receiving it. Fell on deaf ears. And then this came out in the New York Times and the Washington Post, all over the world, how the city of Philadelphia had given this contract to a group of young, budding entrepreneurs with no medical background, young enough to be my children, not that that was a problem, but still, they had given the contract over $1 million to do the mass vaccinations in the city of Philadelphia. Meanwhile, we had been doing all the work with my bank account and collecting lots of bills from LabCorp. By the way, that's how I got them to give me the test, is I said, you could bill me and bill my practice for every uninsured individual. The city then gave them this contract, and there were red flags all over the place. They were going to elected officials' homes, they were vaccinating them, they were wasting vaccine, their counts were incorrect, they weren't reporting it correctly, and they were shut down. And when they were shut down, they called on us because we were validated. I took no one who did not have a license to work with me, and we did the work. And so now, as always, we were taking care of everyone, but now instead of going to the communities that didn't have the resources, now the entire city of Philadelphia was coming for us. And the one picture the New York Times has, you see that's our convention center, completely empty because no one was going there. So as a surgeon, I said, I'll just work 24 hours and we'll knock these out, right? How difficult could it be? I'm used to being on call, working 24 to 36 hours. This won't be difficult. But what happened, we were at the Temple Leah Center, wrapped around the building, thousands of people, it was 17 degrees outside, and I thought, surely once 2 o'clock hits, I'm gonna get some sleep. But then the clubs closed, and then everybody came to get vaccinated after that. And then at about 4 or 5 a.m., nursing homes were dropping off their residents to get vaccinated. I was like, this is crazy. Like less than a year ago, I was operating. So who would have done this had we not stepped up? And then the data came out that we were vaccinating the group of people that everyone was saying did not want to get vaccinated at a rate higher than the health department. We have 5 medical schools in Philadelphia, than all of our medical institutions, because we had earned the trust of the people and because we were intentional and because we were going to them. Afterwards, all the folks that I told you were being turned away because they didn't have ID or they didn't have whatever that we took. When the CARES Act was passed, I was able to submit claims for all of the folks who were uninsured and underinsured, the folks that people turned away. And back then the test was $50 or $100. And so now I was able to submit those claims. And I made well over millions of dollars because this was my practice. So I took those funds and I reinvested it, and I built a Center for Health Equity, as you heard, in one of the lowest life expectancy communities in America. I don't know about Colorado, but I can tell you in Philadelphia, where I live in the suburbs, there is a Jefferson urgent care, there's a CHOP urgent care for my kids, Penn has a satellite, all over, because our payer mix is high and they'll get a higher reimbursement. But if you go to communities where many people use CMS or Medicaid or Medicare, you find nothing. You find FQHCs that are dilapidated, that are old, that are not welcoming, and that's what people have. And even with that, they wait and wait and wait to be seen. So I said, rather than talk about what it looks like to create equity, I'm gonna put this because I know access is a real concern, and we are gonna create the access. And so these are the services we provide. And I thought, okay, I'm gonna build this primary care center, then I'm gonna go back to the OR, and I will just create the foundation for it. Hopefully this will play. Yes, okay, so this is a quick tour of the front when you walk in. And this is our, waiting area, a little glitchy. Have my kid corner. Behind us is our behavioral health suite, and I had that built in the place so that if you were feeling blue, that you didn't have to hear all the laughter and chatter that happens, and folks can walk in one door and walk out the other. And this is our main hallway, where on each door is something beautiful about Philadelphia, because you don't hear beautiful things about Philly enough. That was Marian Anderson. And then this is our touchdown space where we train nurse practitioner students, nurses that come through. Drexel sends their students. The social work students from Alvernia and many other universities come and they do preceptorships with us. And you see it's bright and it's pretty. Someone said, this looks like a pediatrician's office. I was like, well, I don't know. I like the colors. Our break room, our community room, it's 10,000 square feet. And when I was looking for space, because again, I wasn't expecting to earn the money, but what I was finding is that people were coming to us and they were saying, and I was, oh, are you here to get a vaccine? And they were like, no, but I have this lump on my neck that's been there for a while. Can you tell me what you think it is? Or they were waiting in line to say, I have these list of medications and I'm not exactly sure what's for what. Can you explain that to me? Or people were coming to us saying, my son needs a physical to go back to school. You guys are doctors, do you do that kind of stuff? And what I found is that people were coming to rely on us and I couldn't just leave because things were getting better with the pandemic. And so we just recently opened a second location in January. And this is in partnership with the city of Philadelphia, where our mayor, where I'm standing there, and the head of Marikey, which is a behavioral health social work entity, where she wanted to get all of the unhoused and those with challenges with substance abuse and mental health that were living on our streets off the streets. And so after people have been in treatment for a period of time, she renovated this space that was city-owned so that people have a place to live for up to a year. We provide the medical care in that space. So it's a beautiful situation. I've already had a couple meetings this morning because I'm 2 hours behind, just making sure things are running. It's men and women, and we are, in that time that they're getting their vocational skills, we are providing their medical care because many of them haven't seen a doctor in never. And as we care for them, they say things, when we call them Mr. and Mrs., they look up because people have not been treating them with respect. And I'm excited to be a part of this venture. And so in December of 2021, when everybody thought things had slowed down, and you know, most hospitals over the holidays are closed, right? Because half are off for Christmas and half are off for New Year's. This is what happened when the cases went up again and everything was closed, the federal office building. So everyone was coming to us. And this is where the health center is on this campus. And all these folks are wrapped around. Across the street is HUD housing. On the other corner is one of the largest public schools. We are also designated as a school-based health center, which basically means that during the day, children can come to our center and receive care, and we can go into the school and provide care. And it was wet and cold, and this was wrapped around the building. And I honestly, in this moment, could not believe this was happening again. Like, didn't we learn anything from the past months? And because I was a little annoyed, I posted it on X at the time and said, White House, where are you? I forgot I had done it because we were working. And then literally that night, I got a call from the White House. And they were asking me, what do you need? What's happening on the ground and things. And I just explained to them how, while we appreciated the funds that were coming, that it wasn't trickling down, that my staff was burnt out, that we needed clinical support and administrative support. And they sent a FEMA team, which I led the mission. We went into many of the public schools because now children were starting to contract the disease at a higher rate. We went to all the communities that did not, and FEMA came and they set everything up for us. And all we had to do was be the clinicians. And it was a beautiful thing. And then after that, I was appointed as regional director for the Mid-Atlantic, which is Pennsylvania, DC, Virginia, West Virginia, and Maryland. And in that time, it was an opportunity because so often the people making the decisions about what's happening with our healthcare are completely out of touch to what people are really experiencing. And they rely on someone to give them that information, but so often those people are not at the table. So this was an opportunity to be grassroots now with policymakers making decisions. And there were several things that were passed that I was particularly proud of. One was the extension of postpartum care. As we know, the rates for Black women and infants is higher in maternal morbidity and mortality. Also with 988, that was launched with Secretary Becerra in our city, and I was part of that launch. Obviously, working with Dr. Fauci, that book is my Harrison's textbook from medical school. And I said, when I have an opportunity, I'm going to have him sign this book. And I was just talking to him for an hour just about everything, which was really a highlight for me. And it was a great opportunity. But I realized, and maybe if I was younger, that would have been the place for me, but things moved way too slow. And there was too much bureaucratic stuff that you had to go through. And what I realized, which is evident right now, is depending on who's in charge is what priorities get pushed forward. And so you could make progress, but as soon as someone came in that had a different agenda, it was like all those things got undone. And I said, I'm too old for this, I can't do that. And in the midst of all of that, one of the reporters, because people were covering us all the time, and someone was like, are you writing this up? Like, do you have white papers coming out? And I didn't have the time. We had so much data. And so reached out to me about writing a book. And so I sent some things that I had written, and someone asked me, what would make you think as a pediatric surgeon in the middle of the world's worst pandemic that you could save the world? And I said, you would have to know my story. You would have to know what I went through to become a pediatric surgeon. And I talk about a lot of that in the book. I talk about general surgery training, and that was at a time where we were literally, especially as fellows, working 120 plus hours a week, which quite honestly, I didn't mind that. I really didn't. It meant I got to do more cases and so forth, and I didn't mind doing that. But what I did mind was being dismissed, that there seemed to be different rules for women. There seemed to be different rules for a Black resident and a white resident. I didn't mind that. I didn't mind that someone, when they made a mistake, it was, oh, sometimes bad things happen. When I made a mistake, it was, you need remedial teaching and we're gonna put you on probation. And I talk about so much of that in the book because I don't think people talk about it enough, and how I pressed through all of that. And when I finished my training at University of Pittsburgh, I was the first Black woman to finish general surgery in Pittsburgh. And when I finished my pediatric surgery training, I was the first Black woman to complete pediatric surgery in the United States. Many of you know Dr. Andrea Hayes Dixon, and she was the first in North America. But for a while, she and I were the only two Black women pediatric surgeons. And I talk about much of those things. It has resonated with many. Last weekend, I was at the ACGME conference talking about many of these things. And before I go on to the next part, I'm just gonna pause here for a second to say that, and I can't even remember the year, I guess it was 05, so I was, I don't know, early 30s or something. And Dr. Alberto Pena showed up in Cincinnati. And I was about to be the second year fellow. And when he came, because it takes a while for the licenses to go through from one state to the other, he was observing everything. So it was my job to take him around the hospital, to be in the OR, to go over cases, which at first I thought, seriously, I'm the senior fellow. Why am I the person doing this? But I learned so much. And he came at a time, my last year before I finished 9 years of training, and came at a time where he taught me and he invested in me. And for someone of his stature to validate me when I had so many people telling me what I couldn't do, I'll be forever grateful to him for that. And I'll say to you all who are trainees that will soon be attendings and who are attendings that are training the next generation, that sometimes everyone could be saying, get rid of this person, they're no good, I don't know how they got in there. But it takes one person to look at it through a different lens. And you never know what that person may become and how many lives they may save and how many lives they may change. And so, Dr. Pena, thank you for being that person for me. You guys can clap. And I didn't know it, and he didn't know it, but he is like chapter 8 in my book. So if you haven't gotten the book, he was like, I'm in the book. I said, you are, because we all need one person to believe in us. Okay, so the book came out. As you can see, it has been #1 in medical biography, #1 in public health, #1 for racism and discrimination in 3 different categories, and Nature Springer named it a top read in global health. So I'm excited about that. And a lot of medical schools have adopted it as it's the book that you get when you come to medical school. And I know everybody talks about these social determinants of health, and most people will tell you that 90% of what happens to you and your health outcomes happen outside of the hospital. I am telling you that is not true. It is not. It is closer to about 50-50. And what I'm saying to you is that there are many things that we can do within the walls of this hospital that will predict a better outcome for our patients. 12 years ago now, I wrote this article, and I was an attending at CHOP, and I said, with malrotation, I'm seeing different outcomes. And I thought when I wrote the hypothesis, it was gonna be for Black children, but it wasn't. It was for Latinx children. And I presented this at a conference similar to this. I had been working with the best statisticians at CHOP Policy Lab. We put this together and found that once the child came to the hospital, the time it took to get the upper GI, the time it took to get to the OR, if you were a Latinx patient, that it took longer. And they subsequently had more bowel resected, more death, and more complications. Even when you controlled for the language barrier, it still existed. And I presented this, and someone literally stood up and said, that's not true. How dare you present this at our conference? And that was 12 years ago, and then we never talked about it again. We talk about representation, as you heard your chair say. It's so critical. It's so critical. And it does, that racial concordance matters. There's a certain understanding. There's a certain lived experience. When you have one other person in the room, just allow you to see it from a different perspective. We so often talk about that people of color or other groups don't trust the healthcare system. And what I would say to you is that the healthcare system has been untrustworthy. And when you think about it like that, it takes the responsibility off of the individual, and it puts the responsibility squarely on us that we have to earn that trust. No one woke up one day and said, you know what, I think I'm not gonna trust my doctor. I don't think I'm gonna trust them. I don't think I wanna live long, and I'm not taking this medicine because I don't believe what they're saying. No, some things happened, whether historical or directly. And then this came out during COVID. And as a pediatric surgeon, I think for our entire community, it was hard for us to accept that that was true. A healthy child, one Black, one white, same operation, same hospital, no comorbid health conditions. How do you explain that? It's not the 90% that's happening outside. And just to be clear, I wanted to look to make sure the data hasn't changed. And so this is the most recent that I could find. And I talk about my own experiences as a Black woman, and I have 3 children, bless them. I was calling to make sure they had gotten to school this morning, of my experience when I was pregnant, when I was in a hospital, not wearing my badge that says Dr. Ayla Stanford, how I was treated, how I was dismissed, how comments were made at the front desk about me, presuming something about me when they didn't know me at all. And it was in my own hospital. So when we talk about how things are different and how we need to do things differently. There's a lot of inward looking that we need to do. It's not because I didn't have gestational diabetes. I didn't have hypertension. I didn't have preeclampsia. And no one knew who I was until then. I had to wear my badge every time. And I shouldn't have to. And I use my story as an example so maybe people can see what they're not seeing. Dr. Pena always used to say to us, the eyes only see what the mind suspects. So if you don't think it here, you won't see it. And I guess now in this second half of my life, I'm trying to get people to see what is there, even when your mind hasn't computed it. So this is my summary of health outcomes when people talk about determinants. Wealth in our country is measured by home ownership. And home ownership is linked to education. So for me, I live in the suburbs. I pay 30 grand a year for taxes that goes into the schools. And that's how they all have a new Chromebook every year, a brand new one. Whereas in other schools, where most of them are redline communities, there's public housing, there's HUD housing, everyone's renting, and nothing gets invested into those schools. And many of our academic institutions sit on that land and they're nonprofits and they pay no taxes and no money goes back into the school. But we wonder why kids in certain zip codes aren't coming out as prepared. That's how home ownership is linked to education. And education, we all know, is linked to health outcomes. How you can best advocate for yourself, how you can seek out, how my friends were able to call me during COVID when they couldn't get a test. And then all of that is exacerbated by racial injustice. And I use my own story because, again, I can tell you how I was treated when someone did not know I was a physician. And so this acronym, again, goes back to recognizing that bias impacts our care. And so I would say the first thing we have to do is acknowledge it exists. There's a lot of folks that say it doesn't exist. And I try to keep up with that literature as well. I saw something recently that said social justice has ruined medicine. It should never be a part of medicine. But when it's so politicized and whether people have care or not depends on who your leaders are, it has to be part of it. So first we have to acknowledge, and then you have to believe that none of us in this room created the intergenerational wealth for some and the intergenerational grief for others. We did not create it. We were born into it. But we have to acknowledge that that intergenerational wealth for some created legacy and building and home ownership and transference of information, as opposed to when you're striving to survive, there's none of that that's happening. And so the fields aren't level. And I know there's no DEI, and I know there's no affirmative action. It doesn't make any of this go away. And so that's where we all are looking at our own moral compass for best practices. Once you acknowledge, believe, it's identify. What can you do? What can I do as an individual to not be part of the exacerbation of health disparities, but more the eradication of them? And then once you do something that works, you act on it, and then you share it. Share what worked, share what didn't work. And so this is honestly what I am living by these days. So what can be done? And again, I can only use my example and show that it can work. And so as I was doing my work, the University of Pennsylvania reached out to recruit me to say, what you have done, we have not seen done, and we need you to teach the next generation. And I thought about that for a while, like, is this a space that I really want to be in? And you see, I keep trying to get back to the OR, and then something else happens. And so in this role, I still run the 2 medical practices. I have a class that I teach, which is the intersection of biology and health, where we talk about environmental factors, we talk about present day factors, all that impact health outcomes. And I have policy students, I have law students, I have kids from Wharton, I have biology students, and their minds are so malleable. And they want to do something and they want to understand. And so this has been great. I enjoy feeling like I am part of preparing the next leaders. Also, in Penn Institute for RNA Innovation in the medical school, unexpected friendship between myself and Dr. Drew Weissman, who won the Nobel Prize for his work on the COVID vaccine. He said to me, it doesn't matter how many things I create and how many things I design if people don't trust me to use what I make. And that's where I need you. And then the School for Communication said to me, in the middle of the pandemic, we were putting out all these things that were not resonating, but what you did resonated, and we need to bottle that up. We need to scale it and move it not just in Philadelphia, but across the nation and the world. And for me, it's a great opportunity because, you know, they say if you want to go fast, go alone. If you want to go further, go together. And so I feel like I have that collaboration now. This is still pictures from a video that we submitted to the MacArthur Foundation, the 100 million and change. And basically, that's Dr. Freed from the World Health Organization and Dr. Kiat from Thailand. And before he was creating the COVID vaccine, what he did was, Dr. Weissman, is he put a manufacturing plant in Thailand so that the people could make their own therapeutics and their own vaccines. And when the pandemic hit, they were able to do just that. The MacArthur grant that we submitted was ultimately to put these GMPs on all 7 continents, and then to go and to teach the people how to make their own vaccines and make their own therapeutics so that they don't have to wait from the Western world to get what they need. And so as many people won't die that died unnecessarily waiting for it to come. So I just heard on Friday that we made it to the next level. So I'm excited about that. And it has really been an honor to be in a room with people that when there are complex problems, we're thinking about how to solve them, not it's been that way forever and that's the way it's gonna be. The other part is that nationally, I have an opportunity to talk about improving health outcomes with an audience that wants to hear about it. And then at the same time, have my public service announcements for the flu and for COVID. And my goodness, I just learned yesterday, there's some measles cropping up in Philadelphia. Which I have to deal with when I get back, but yeah. And this is one of my classes at the university, which I said I really enjoy. We also have a summer program where I get college kids that come and high school students that sneak in there, and just letting them know the steps it takes to become a physician, because a lot of times they don't have doctors in their family or someone to show them the path. One of my attendings used to say, you can't win at the game if you don't know the rules. And so what we're doing at a young age is teaching them the rules so they'll be prepared. We've gotten funded for a couple grants, increasing vaccine uptake in high schools. Here are some social work students and post-bac students that are working with me. And we're at back to school night. Because if you want to talk to the parents about what their children need, if they have questions, you have to go to them. And so, again, I use all the younger folks because they're much better at this than me, but that's what we do. We go and we talk to them about it, and it's been different. So that's what I feel like I can do. But I implore each of you to feel like, to ask yourselves, what can I do? This was just in the New York Times, I want to say yesterday morning, but it's been running for the past 4 days about transplantation. And when I was in HHS, they had come up with a new scoring system for heart and lung. But there were so many ingrained biases in it that they didn't even see. For example, your proximity to a transplant center, how long you've been on the list. And so often, the doctor has to refer you to be on the list, right? Typically, it would be the sickest patient, but if you're the sickest patient, but you haven't been on the list for a long time, that doesn't bode you well, you just die on the list. Another was, if your doctor felt like subjectively you could follow the immunotherapy and the treatment and the immunosuppression. That was another criteria. The only one that I felt like had no wiggle room was the age. Oh, another one was if you had been a living related donor, if you had been a living related donor or someone in your family had been a living related donor, that also put you higher on the, it was just all of these things that were not applicable to certain populations. And what the New York Times exposed, which may not be exposing to many, is that the nonprofits are the ones that determine where the organs go. And so often, as I know with a nonprofit, it depends on your funding. So the ones that have the best funding are the ones that are getting to that organ first and making sure it gets to their network. And so what they basically found was that certain institutions that had more resources were where the organs were going, even though there were people sicker higher up on the list that were not getting it. And there's no one really policing this at all. And so I put this here. I'm not a transplant surgeon, but I read the news every day. And when I saw this, it gave me pause. And so my final thoughts with you all, and I hope we can all agree, I tried to put some non-controversial things here, is that health disparities exist in America. I think we could all agree on that we can do better. I hope that the next time someone says to you that it happens 90% outside of the hospital, that we can pause and think, is there something else that could have been done or that can be done for a better health outcome for my patient? Education, who and how we train the future of medicine is integral to improving health outcomes. First, do no harm includes eradication of substandard treatment. And I'm telling you, it's substandard. And again, here, maybe totally different. I don't know the climate here, but I can tell you other places I've been and the things I've seen, I can honestly say I'm shocked. We are, and you are, the answer to improving livelihood and life expectancy in our nation. Thank you. I can certainly take any questions. Yes, doctor.
Stanford, thank you so much for coming and delivering this wonderful presentation. And you know, I think given the political climate, probably our strategies have to change a little bit.
Absolutely.
But these problems exist. They may actually worsen. And I think we as physicians and scientists owe this country dedication and work in these areas. And, you know, I think, again, and you brought this point up a couple of times, that really getting to the younger folks in our communities and in our country, middle schoolers, high schoolers, is really important to change the dynamic.
Yeah.
Because if you just wait for the issues to keep going and the problems to occur and address it at that point, that doesn't really solve the problem for future generations. And I think it's so important what you're doing, bringing younger students in and showing them what careers in medicine look like, how to get scholarships, how to apply, which programs to apply for, what things look like on your side of success to them if they put in all this hard work. So I agree with you. That's where we have to invest a lot of energy. And again, thank you for this wonderful talk. I'd be interested in your comments on that. Thank you.
Thank you. Well, let's see, just this Thursday, we had a panel discussion. And again, during COVID, I felt like I was moving on my own, but now with the health commissioner of the city of Philadelphia, with the managing director or the mayor's office, with the NAACP and myself and community leaders, just having sessions to let people know, because people's insulin has gone up, right? And I need to create a list of resources, or we collectively, where they can still get their medication paid for, that it went from $35 to $350. And people are going to lose their life from that, right? I worry a little bit about, well, I've already been thinking about the fact that typically the CDC and the ACIP has a meeting around this time to decide which strains go into the flu vaccine for August. Well, that meeting was canceled by our Secretary of Health. And so we know that there's a new strain, but that collective meeting of the best minds coming together to say, this is the strain that should be in the flu vaccine for August, September is not happening. So either it's gonna be convened later and we're gonna be behind and flu season is gonna hit, or it's not gonna happen at all. And things I've already been thinking is, instead of sort of returning the vaccine that you don't typically use, is keeping it. Seeing which folks have stronger immune systems, because as we know, we've been getting flu shots for 20 years and we've probably got some built up immunity, plus from having the flu, we may be more protected than others that are naive, but thinking about how we're gonna manage that. I also think about the students in the schools. I'm not sure about your schools here, but our public schools are heavily funded by the federal government, or a significant portion. And we already received a letter from our superintendent that said, if we are if anything we are doing is considered discriminatory against the Civil Rights Act, you're in danger of losing your federal funding, which means no school lunches, which means no funding for books and all sorts of things. So school districts have to make a decision. Are we gonna stop these, sort of groups where they might have Asian Pacific Islanders and they might have the Latinx whatever, and they have the LGBTQ plus club for the high schoolers? If we don't remove these things, we can lose our funding. So are they gonna wash all those things away and run the risk of not being able to feed and educate their students? So that's where I believe the community, academic centers, the private sector, philanthropy have really got to come in, and we have to be in a place that we can present it to them with a real business model and say, if we don't do X, this is how many lives are going to be lost, right? I'm really concerned about the fact that measles is popping up everywhere. We've got Texas, we've got Florida, and now we've got Pennsylvania, right? And this is even before stopping the mandate, or stopping the mandates for vaccines for kids to go to school. So that's where it's going to take, and I recognize that folks need to be in the OR because we're surgeons, right? And funny story, my chair of surgery, when I first started, because I came back home to Philly and people were inviting me to speak all the time, and my chair said to me, that's great what you're doing, but I'm not paying you to be an inspirational speaker. So I'm paying you to operate. So from that, I formed a nonprofit, and then different people could come and be a part and speak at different times. So it didn't always have to be me. So what I would say is collectively that everybody can't do it, but there can be a little bit of folks at a time going into, because which communities are going to be impacted most. Just by the zip codes, you guys can probably figure that out, and providing resources of alternative ways that they can feed their, especially women, infants, and children for WIC, right? And also that they can get the medical care for their seniors. That's who I'm most worried about, the youngest and at the other end of the spectrum. But we are gonna have to fill this void, and as loud as they are, other folks with misinformation, we are gonna have to counter that with accurate information. So this is totally different than what I imagined. Not you guys, I just mean my life in general. Like it was, I'm gonna go to medical school, I'm gonna become a pediatric surgeon, I'm gonna operate, I'm gonna whatever, I'm gonna pay off my student loans. And COVID happened, and I was all of a sudden in a space where people needed they needed care, but also information and also hope, right? And once I was in it, it was hard to step away. And I have my conversations with God, and I said, you know, did you really have to send me to school for 18 years after high school to be an advocate and own a primary care practice and a teacher? But what I realized is that validity and the reverence that I believe was afforded to me as a surgeon is what carried me as far as it has. The fact that we don't take no for an answer, the fact that we're the ones that everyone comes to when no one else has a solution to a problem, like those values that are ingrained in us. In the middle of this, I really didn't have a fear of much, just because I knew what would happen if we didn't do something. And I would implore all of you to think about that. We all have extra skills and stuff, you know? And I didn't expect any of this to happen, but here we are. So I guess whoever you believe your creator is, sometimes they have a different plan for you.
So I also just want to quickly thank Dr. Washington for being your friend and being able to attract you to come here, but also for what Dr. Washington has brought to this campus. As I think most know, she was granted a $47 million contract from ARPA-H, leading 6 different institutions.
Yes, 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 yes.
And I think the way that she has taken this space on in the Department of Surgery has been so impactful and important. You know, by no means are we there, and we have a long way to go, but her leadership is very important. And thank you to the both of you.
Yes. I'm not surprised by that. She was a superstar as a resident too. Not surprised at all.
Thank you again.
Here's, I can talk.
May I ask a question, Dr.
Yeah.
Washington? Dr. Stanford, very inspirational, your talk. You did touch on the being operating and being able to, your chair. Dr. Schulek never told me that, like, you know, you can't go give talks because you have to be operating, but we know this is a reality.
Yeah.
In terms of being productive in the operating room and being very limited what you can do. But my question is about being an upstreamist. You know, it's a concept that Dr. Machanda had about going above the medical care and looking at the communities that are underrepresented, and they have some issues with like housing and other things that you mentioned. How difficult it is to I wouldn't say negotiate, but how difficult it is to convey that to the politicians that you have been in touch with in Philadelphia, how difficult it is to try to organize something to help the patients at their houses, not in the medical centers, focusing on the other 50%. You said 50% is in the medical center.
Yeah.
What happens to the other 50%? How difficult it is to work on the other 50%, that's housing, that's education, like you mentioned, with the political atmosphere that we have these days?
It's very difficult. And as we talk about in my, at Penn, sort of in the hallway, we feel, it seems almost like social Darwinism. like it's survival of the fittest. If you got it, you got it. If you don't, you don't. And almost as if medicine this is in my mind, and again, it's just a concept, but people feel like medicine is interfering with natural selection. So you're not going to get empathy from our current administration because that's not their mindset. You know, the mindset is more dollars, 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 and money. It's not lives, 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 because their lives are protected. Like, this is foreign to them. Do you know what I mean? Like, to sort of be part of a working poor and have to decide between medical care and food. It's a foreign, and so I feel like you can put some emphasis there and present it. It used to be, like, one of the ways that used to work for me with other groups is if you can show an institution or an entity like the city of Philadelphia that they look good doing it, right? If they look good doing it and it doesn't cost them a lot of money, they're usually all in because everybody wants to put their name on everything, like show and tell, look what we did, right? But I personally don't believe that they care about that. So that's not a strategy that will work. So I don't know. I feel like certain folks' minds are what their minds are, and everything they've said they were going to do, they're doing. So it's not like it's a secret agenda. You know, they said, we're gonna get rid of the Affordable Care Act. It's coming. They said, we spend too much money on healthcare. They said, I don't trust the CDC and the NIH because there's not enough scrutiny. So instead, we're just gonna get rid of it. Like, all these things they said. So I don't know. I mean, my door is always open to compromise and have conversation, but I don't know how far we'll get with that, which is why the emphasis is more on the private, the philanthropy, the academic institutions. And in terms of those other things like, you know, food, education, it's so ingrained. It's not just a city level, it's a state level, how they allocate funds and things like that. And it's really the legislators that have to decide that the kids with least deserve more. And it's really, I mean, I don't know how else to describe it. It's not, because in order for you to bring forth legislation, it's an internal decision, right? It's a personal choice that you say that this matters. And if you don't think it matters to you, then you won't change it. And so I've sort of given up I'm waiting for someone to come save the folks and just decide that maybe I'm the one to bring other people along to help save them. I know that's a long answer, but there's somebody in the back.
Hi, thanks for taking this last question, and I really do appreciate this talk. This has been amazing, Dr. Stanford, Dr. Washington. You know, given everything that you said and your experience, my question to you is it possible to be a community leader, be an inspirational speaker, do all of these things, given all the deficits we are about to face, and be an academic surgeon? Is it always an either or it can be an and?
Well, I don't know. What kind of surgeon are you? It depends. No, I mean, quite honestly, I operated, I might not look like it, but for 25 years. So for me, you figure I graduated medical school in 97. So at 28, so I feel like what I did allowed me to have the platform where I am now, right? Can you do both? I think you probably could, but I am allowed to focus all my energy right now in this space. And I know that I'm impacting more lives. And I think at a certain point, and you look younger than me, but at a certain point, it's how can you have the most impact with what you do? And I feel like I had a great impact for over 2 decades operating and taking care of children. But parents want to see you. you know? And you can't be on the news doing this and whatever when your parent wants to know, you know, about how quickly the wound is going to close, you know, or when their child can start eating. And so I'm not saying it can't be done because I'm not a can't person. I don't think no exists. It's just not right now. But I do think you kind of prioritize a little bit. And especially for the junior people, I would say I was able to go so far because I had invested at a younger age as a fellow. And when people can talk about you positively and you don't have to say a word, that's, I don't know if that's what you would call success, but that's where you want to be. So all of the things that were written about me, I wasn't writing them. You know, other people were doing that, but that was because I operated on all their kids for like, you know, 20 years. So their parents were saying it. The kids were now teenagers and they were saying, hey, that's my surgeon, you know? And so I think there's a time and a place, but that's a personal decision. Doing both, can it be done? Yes. Would it be hard? Absolutely.
Well, again, thank you so much, Dr. Stanford. I'm just honored to have you here. And you can see she's a very busy woman. I am so grateful that she took the time to come here. And as you can see, when I said what I said about her brilliant light, that she is a true light in the world. And I'm just looking forward to see what you do next. So thank you again. And we have a swag bag, which we give everybody with all of our great department goodies in it. So we want to just present this to you and thank you again. Thank you.
Thank you.
That's great. Thank you so much. And also, I just want to encourage, she has a session with the residents from 8:30 to 9:30, and I encourage you to all attend and just